When we think about intimacy, connection, and building a family, we often focus on emotions, love, and compatibility. But there's something many couples overlook. Something that could silently affect your future together. It's not chemistry or communication. It's blood, your blood type. Most people don't know that a simple detail like your blood type can have real, physical consequences on your partner, especially when you're planning for a baby. And yet, it's rarely talked about until it becomes a serious issue. If your blood type is R positive and your partner's is Rh negative, or vice versa, you may be facing something called R incompatibility. Sounds clinical, right? But its impact is far from just technical. It's deeply personal. It's emotional. It can be life-changing. Let's break it down. Her factor is a protein found on red blood cells. If you have it, you're R positive. If you don't, you're R negative. Now, if a woman is R negative and she becomes pregnant with a baby who is R positive, because the father is R positive, her body may see the baby's blood as a threat, as something foreign. And just like the immune system would attack a virus, it may start attacking the baby's red blood cells. This doesn't usually affect the first pregnancy. But in future pregnancies, if precautions aren't taken, the risks grow. The mother's immune system becomes sensitized, and those antibodies can cross the placenta. It can cause anemia in the baby, brain damage, or even stillbirth. And here's the heartbreaking part, this could all happen while both parents are unaware they were ever incompatible to begin with. Now imagine how that impacts a relationship. The grief, the confusion, the guilt. When no one tells you that something as simple as a routine blood test could prevent it all, the burden becomes heavier. But knowledge is power. That's why talking about this isn't just medical. It's emotional wellness, it's relationship protection, it's love in action. In most developed countries, including the UK, this is something easily managed. With early testing and the use of a medication called RhoGAM, doctors can prevent the mother's body from creating these harmful antibodies. But for that to happen, couples must ask the right questions. Before pregnancy, not after. So, if you're in a serious relationship, or thinking about starting a family, this is the time to talk, get tested, know your blood types, have that slightly awkward but incredibly important conversation. It's not about fear, it's about preparation. About stepping into partnership with open eyes and hearts. And yes, talking about blood types might not feel romantic, but protecting the health of your future child, that's the most loving act of all. You don't need to be a doctor to make informed choices. You just need to care enough to ask. Because sometimes, what you don't know can hurt the person you love most. When two people decide to start a life together, they often think about love, shared values, dreams, and maybe even starting a family someday. But what rarely crosses anyone's mind is something as basic yet crucial as blood type. It sounds simple, even irrelevant in the face of emotional connection. But when it comes to pregnancy, the compatibility of blood types, specifically the Rh factor, can silently shape the course of a couple's experience, sometimes with dangerous consequences. If a man is R positive and his partner is R negative, their baby can inherit the father's R positive status. This difference can trigger a biological reaction in the mother's body, where her immune system starts to treat the baby's red blood cells as foreign invaders. It's not a conscious act of rejection, it's the body's natural defense system doing what it's designed to do, protect. But in this case, that protection can become harmful. This reaction is known as R incompatibility, and it's not just a textbook term or a technical medical issue. It's a real life concern that can affect the physical well-being of a woman and her unborn child. What's most concerning is that many people in relationships aren't even aware of their own R status, let alone the risks that incompatibility could bring. Without that awareness, they may walk blindly into a situation where the mother's body begins forming antibodies against the baby's blood cells. These antibodies can cross the placenta and start destroying the fetus's red blood cells. It's a slow, silent process that often shows no symptoms in the early stages, but the consequences can be devastating, leading to severe fatal anemia, organ failure, brain damage, or even stillbirth. What makes this issue even more complicated is that it doesn't usually occur during a first pregnancy. The immune system typically becomes sensitized after the first exposure to R-positive blood, which means the threat often builds without detection until it's too late. That delayed danger makes it even more important for couples to understand their blood types early on, before pregnancy begins. Our incompatibility isn't about blame, and it's not anyone's fault. It's about biology, plain and simple. But if not acknowledged and addressed in time, it becomes a threat not only to physical health, but to emotional well-being, to the trust and safety couples hope to build when they bring a child into the world. One of the most concerning aspects of our incompatibility is that it often doesn't present itself as a serious threat during the first pregnancy. That can lead to a false sense of security for couples who remain unaware of what's happening inside the mother's body. In most first pregnancies involving our incompatibility, there's limited mixing of the baby's blood with the mother's, so the mother's immune system may not have a strong reaction at that stage. However, if the blood does mix, through childbirth, miscarriage, abortion, ectopic pregnancy, or even certain prenatal procedures, the mother can become sensitized. That sensitization means her immune system has been trained to recognize our positive blood as foreign. And once that immune response has been triggered, it doesn't go away. It stays in her system, ready to react during any future pregnancy with another R-positive baby. This immune memory is what makes subsequent pregnancies much more dangerous. The antibodies that were produced after the first sensitizing event can now cross the placenta early in pregnancy and begin attacking the baby's red blood cells before the child even has a chance to fully develop. This leads to a condition called hemolytic disease of the fetus and newborn HDFN, which can cause severe anemia, jaundice, heart failure, or even death in utero. The baby's body becomes overwhelmed trying to keep up with the destruction of red blood cells, and vital organs can be damaged beyond repair. What's most heartbreaking is that all of this can unfold without any warning signs. There may be no pain, no discomfort. Just the gradual, invisible breakdown of a baby's ability to survive. For many families, this trauma only becomes visible after a tragedy has occurred. A miscarriage that couldn't be explained. A stillbirth that seemed to come out of nowhere. Or a newborn rushed to intensive care minutes after delivery. And in each of these situations, there is often confusion, guilt, and a haunting sense that something could have been done if only they had known. The danger doesn't lie in being ART-positive or ART-negative. It lies in not knowing, not asking, and not preparing. The second and third pregnancies are where ART incompatibility becomes more than a quiet threat, it becomes an active danger. This is why awareness isn't just helpful, it's essential. Because with each pregnancy, the stakes rise, and without intervention, so does the risk. The good news is that our incompatibility, while serious, is entirely manageable with the right medical awareness and timely intervention. Modern healthcare offers clear, effective solutions that can prevent this condition from ever harming a child. It begins with something incredibly simple, a blood test. During early prenatal care, both partners should know their R status. If the mother is R negative and the father is R positive, then doctors immediately know there's a possibility of R incompatibility, and they can take the necessary steps to protect the pregnancy. This isn't just routine, it's proactive, life-saving care. One of the most effective interventions is an injection called RhoGAM immune globulin, more commonly known as RhoGAM. This injection works like a shield. It prevents the mother's immune system from developing antibodies that would attack R-positive blood cells. It doesn't reverse sensitization if it's already occurred, but it can stop it from ever happening in the first place. This injection is typically given around the 28th week of pregnancy and again within 72 hours after childbirth if the baby is R-positive. It may also be administered after any event where fetal blood could mix with the mother's, like miscarriage, abortion, or certain invasive procedures. The beauty of this treatment is in its simplicity and effectiveness. With proper administration, the risks associated with R incompatibility can be reduced to almost zero. It transforms a potentially tragic condition into one that is entirely avoidable. But the key to its success lies in timing. If couples don't know to get tested, or if healthcare systems overlook it, then the opportunity for prevention can be missed. That's why education is so vital. It's not just about giving a woman a shot. It's about empowering her with information, giving her the ability to advocate for her own health and her baby's future. Many people assume that pregnancy complications are unpredictable, but this is one that doesn't have to be. It's within our control. as long as we treat it seriously and take the steps early. It's a powerful reminder that science and compassion go hand in hand in modern healthcare. When couples understand their biology and work with their medical providers from the start, they gain more than safety. They gain peace of mind. And that peace becomes the foundation for a healthier, more confident journey into parenthood. When two people come together in love and decide to build a life, their bond is rooted in trust, connection, and shared goals. But truly caring for each other means going beyond the emotional and looking at the practical, even biological, factors that can shape a future together. Understanding something as basic as your blood type and how it relates to your partners isn't just about health. It's about taking responsibility for one another in the most intimate and meaningful way. It's about showing up for your partner, not only in romance, but in readiness, preparing together for the challenges that could lie ahead. When couples know about our incompatibility and take action to protect against it, they're not just making a medical decision. They're expressing love in its most protective form. In many relationships, topics like blood types or medical compatibility aren't brought up until a problem forces the conversation. But by then, damage may already be done. Having these discussions early, asking these questions before pregnancy, is an act of emotional maturity. It shows that you're thinking not only about creating life, but about safeguarding it. And when both partners participate in these conversations with openness, it deepens the trust between them. It sends a message. I care enough about you, and about the future we're building to ask the hard questions now. It's not always easy. Medical talk can feel unromantic, and for some, it might even bring discomfort. But intimacy isn't just about physical closeness. It's about vulnerability and care. When couples include health awareness in their relationship, they become stronger, not just as lovers but as life partners. Knowing your blood type is no longer just a piece of medical trivia. It becomes a symbol of partnership. When a man understands that his R-positive blood could impact his R-negative partner during pregnancy, and he takes steps with her to plan and protect their future child, that's more than medical compliance. That's love in action. Too often, couples suffer in silence because they didn't know what questions to ask. But when both partners take ownership of each other's well-being, they create a safe space where love isn't just felt, it's lived. In that space, the relationship matures. It gains depth, awareness, and an unshakable foundation based on honesty, education, and mutual care. That's how a family begins, not just with biology, but with the shared commitment to protect what matters most. Understanding the risks of RH incompatibility isn't just about science. It's about safeguarding love, protecting future children, and building a foundation of awareness in relationships. When couples take the time to learn about their blood types, ask important questions, and take proactive steps, they're not only avoiding preventable medical complications, they're nurturing a partnership built on mutual respect, trust, and care. Love alone cannot prevent medical risks, but informed love can. Every relationship deserves that kind of intentional protection, and every child deserves to enter the world with that level of preparation behind them.